How's it going, everyone? Welcome back to the channel. My name is Gianluca, aka Dr. Calcagno. I am now finally, at this point, a fully graduated doctor working in family medicine. I finished my residency program earlier this month and have been working very hard to get my office set up and get things up and moving so that moving forward, I have my stable go to work and try and figure out my schedule as best as I can. Having said that, I really wanted to talk about this video here today. I was doing some paperwork the other day, had about 3 hours of paperwork to do between all this different stuff going on in the beginning, and I came across this video from a channel called Gooby and Dooby. It's called "I was an MIT educated neurosurgeon, now I'm unemployed and alone in the mountains. How did I get here?" The video was put out July 9th of just last week, not even a week, and in that time has got more than 5 million views. It's gone viral, I think more so than any medical video I've ever seen before. I don't think I've ever seen a video like this be so popular so quickly, and I think that's because it really resonates with people. So I tried to look into the author of the video. Gooby is what he goes by here. He's a neurosurgeon, was a neurosurgeon. Beyond that, I don't even know his own name. I looked into him as best as I could. The reason why I wanted to talk about the video today, though, is because as a new doctor, one of the things that I really like to do is learn from other people, especially people that have been through similar things, or even if they're not in the same field, have gone through the process already, and try and get insights from people with more experience and how I could use that in my own practice. And that's what I want to do with today's video. It is longer than 45 minutes. We're not going to go through the entire thing. I would highly advise that everyone go and watch the full video themselves, because I did. I watched the whole thing and I thought it was really good. I don't agree with everything. There's a lot of really interesting points that he shares that we're going to talk about, some things that I don't. But thanks so much for sharing it, and let's get to it.
Hi, I'm Gooby from Gooby and Dooby. So I used to be a neurosurgeon. I went to college at MIT and did 4 years of medical school and 6 years of neurosurgery training, and I was a neurosurgeon for almost 10 years after all of that. So that's 20 years of my life. And I quit. I quit last year, and nobody understood why I quit.
So just on first reaction to that little opening there, I don't think a lot of people could ever understand how someone, especially a doctor, especially a neurosurgeon, could quit. I think as you go through your training, maybe, and some people that I've talked to, you have a little bit more insight as to how things like this happen, and I see it. I've seen people before that have quit the field. We do videos talking about all these YouTubers that end up quitting medicine because they find something alternatively that gives them more money or more flexibility. That's not the case here. You'll find out in a little bit he didn't quit because he found an alternative that was a better job. I'll say that to medical students going through the training, the prospect of quitting sounds insane, and I think that's probably the best way to put it, especially when you know that you're going to be graduating with hundreds of thousands of dollars of debt. I believe he trained in the States, which is typically more expensive than the Canadian education. But even myself, let's just say I am not in a financial situation right now where if I quit work, I wouldn't be okay. Quitting my job at this stage would just kind of trap me with so much money in debt and student loans that I don't necessarily know how many years I would have to work with this rate of interest to pay it off. Like it's kind of not possible for me to quit my job right now.
So I became a doctor to help people. And I remember at the beginning of medical school, when I was just starting, there was a ceremony, and we all took a Hippocratic oath. And I remember there was one of the older faculty docs, and he said that your job as doctors is to relieve suffering. It's not to do a surgery or give a pill. It's to relieve suffering.
So to those of you that are currently in the medical space versus those of you who are not in the medical space or gone through the admissions process, the answer of why did you become a doctor, and it's to help people, is one that comes up so often. It's actually an answer that comes up so often that even myself, in trying to help other people get into medical school and doing some tutoring and things like that, it's such a generic answer at this point that I don't advise people give it in an admissions committee, but that doesn't subtract from the fact that, at least in the overwhelming majority of cases, I truly believe that that is one of the foundational reasons why people get into medicine. In my time going through undergrad and high school before that, and then even my medical studies and traveling the world and doing things now, I have so many different friends, and many of them make way more money in other fields than in medicine. And in their fields, they have better hours, and the job itself, like listen, as a family medicine doctor, I do things in my office that a lot of people would say is not the most glamorous job. The amount of digital rectal exams that I'll have to do throughout my career is probably astonishing to many people, if you actually just were to tally it. Not that I do, by the way, but it's not a glamorous job in many aspects. But all of us choose to go into the field, at least in part because we want to make money doing something that we perceive as a net benefit to society, or at least to a few people that we get a chance to interact with. And that's whether you're going into family medicine or cardiology or neurosurgery, you kind of find your interests. But the foundational principle of helping someone else, I think, for many people, is the reason why we still choose to get into it.
But something was not right. I was very unhappy. And on the surface, it didn't make sense. I was getting paid very well. It's really complicated, and I'll do the best I can to explain it. Going back to medical school, when I took that oath and I had that older professor say that your job is to relieve suffering, that's what I understood of what it means to be a good doctor. And I had learned all these fancy spine surgery techniques to do all this incredible surgery work through tiny cuts. It's called minimally invasive spine surgery. It's the latest technology. We use navigation, like a GPS inside the operating room. Like all the latest techniques, I learned, and I learned how to do well, and I did them, and I helped a lot of people out. But there were way more people that I couldn't help.
So here's some insights from myself as a new doctor, gone through residency the last 2 years, and now working in my office and doing some rural emerge. His point about the fact of the matter being that you could be the best doctor ever, and you can't help everyone. And that's something that most times you end up learning in medical school. For myself, it was being in the emergency department and seeing the pain on everyone's face when there is a resuscitation of a newborn. You have the code pink, and you can't help them. You have the most trained people in the country in one room, and you can't help them. And there's nothing that you could have done in that situation. In my current scope as a family doctor that also works in the rural emerge a couple times a month, there's two different sides of that. There's the acute side, where someone will come in with a ruptured AAA, and the surgeon is too far away, or they came too late, or just the nature of the injury, the mechanism itself, you can't fix it. And you end up losing them because there's nothing you could have done. The amount of blood loss and that quickly, it's a tragedy, and you can't do anything about it. On the other side, there's the aspect that I really like about family medicine, which is being able to preventatively help people, and to help people with things that don't involve surgery or don't involve medications. And let's talk about that for a second. All of my patients that have ever seen me before will all tell you that my practice as a family medicine doctor is to, when possible, avoid medications altogether. If I can solve your problem without medications, I prefer that 10 times out of 10. Reason being is because, number one, it makes your life easier. You don't have to worry about taking medications multiple times a day. No one wants to do that. The other side too is that there, in many cases, are side effects to the medication. So every time we try and fix something, for example, someone with leg swelling in both legs because they have heart failure, we increase your Lasix, your furosemide diuretic, and then as a result, you go into the bathroom all the time, or you are at an increased propensity for kidney problems, you have to go to the hospital, and when possible, I like to avoid medications, but you can't always do that. And that's something that you end up seeing, that even in instances where you could try no medications, you could try medications, you could try and do surgery, there are certain instances where you just can't help certain people. And that's something that first you have to reconcile with as a doctor, and then the hard part is trying to get your patients to understand that sometimes.
I can do surgery to cut out like a bulging disc to remove something and make more room for a nerve, or I could do a surgery where I put titanium screws and rods into the spine and lock it down and remove motion. It's all removing things. The only thing that was adding things was putting in a little electrode to block pain signals if there was nothing else you could do. But those were the tools I had. I learned to use them really well. But what I realized later on is that those aren't fixing the problem. There's so many people with back problems, neck pain, back pain, nerve pain down their arms and legs. Surgery might make them better for a little bit, but it didn't address what caused that disc to wear out, or the disc to bulge, or the joint to get loose, or the disc in between the bones to disappear and then the bones are rubbing on each other. Those surgeries, they don't address that. A PA, a physician assistant that I worked with, he made a good analogy that the surgeries we're doing is like this. It's like you have a house and the roof, the top of your house has a leak somewhere, and rain water is coming down into the house and it's ruining the drywall, and you can see it. You can see water damage. The surgeries that I could do were like going into that house, tearing down that drywall, ripping out the moldy insulation, putting in brand new insulation, and rebuilding the wall. But not fixing the leak in the roof. That's what I was doing. And the way I realized that is that I could do a perfect surgery and some people would get better. Some people would stay the same. Some people would get worse. Even though I did the exact same perfect surgery. And some people would get better before I could operate on them.
I think one thing that the general public a lot of times, especially people that they criticize doctors as being, too quick to prescribe medications or too quick to offer surgery or another intervention that we could take, is people don't understand how many people come into my office asking me for these things. They don't want to try lifestyle changes. They don't want to try more exercise. They don't want to try diet. They say that many of these things they've tried in the past and it hasn't worked for them. And they're looking for a quick fix. And they're looking for that magic pill, or they're looking for a neurosurgeon to go in there and fix all their problems. But I think that analogy that he gives, or that the PA told him, is spot on. That in many of these cases, and that's what I try my best to tell people, is that if you don't fix the underlying cause of your issue, then you're just going to have something happen in the future. If you are significantly overweight, if you are obese, and you are having recurrent episodes of sciatic back problems, for me to just keep offering you medication, for you to go to the emergency department and ask for opiate medication, which isn't actually the best medication for that type of pain at all, it doesn't actually treat, number one, the inflammation in that case, and number two, the cause of your recurrent sciatic type of pain. And that should be to increase the amount of physiotherapy you do, increase the amount of exercise you do, help with the weight loss. It's been, scientifically shown and validated in multiple studies. That's what we should be focusing on. But many people, through a lack of education, through frustration that is built up from years and years and years from their own personal trauma, all these other things, don't want that. They want the quick solution. And I can understand that. I can understand someone being in pain. but it's something that you see time and time again. And now I think it's really interesting for me to see this neurosurgeon come out and say it, and to say that he could have been this amazing surgeon and you could have the perfect surgery. One thing that I always try and tell my patients is that we ideally need to be getting to the core problem here and address that first.
It really bothered me. I felt that wait, there's something missing here. My surgeries are not, they don't seem to be addressing what's causing people's health problems in their spine. I mean, they sort of do, but not in the way that I thought. Not in the way that I thought when I was training. And so over 9 years, I did everything I could try to figure out, how do people actually get better? And how do they get worse? And I had help along the way. I had a really good partner who was a pain management doc at my first job, and he really clued me into a lot of the things I'm gonna explain here. But I just started asking patients like everything I could think of. What do you normally do? What's your job? What do you eat? What do you drink? Do you smoke? Do you illicit drugs? Do you have a lot of friends? How's your family? Are you stressed out? Do you sleep well? I just would ask all my patients this whole bunch of questions about their life. And what I found was that patients that did certain things would get better, and patients who wouldn't do those things would get worse. Or that my surgery might help them out a little bit, but they would get worse after that.
This part of the video I thought was, for me in particular, incredible to see. And this, to me, looks like a neurosurgeon discovering that they probably would have enjoyed family medicine. I actually left that in the comments, and at the end of this video, he describes that he's doing really well now and he really enjoys what he's doing. But I really think this individual here would have preferred, or would have really liked, a family medicine, holistic approach to medicine. I have the pleasure of seeing people across a wide variety of ages in my practice. So I see people from ever since they're born, a couple days old, all the way to people in their 90s. And as time has gone on, the last 2 years, 2 and a bit now, I've asked the 90-year-olds, because it becomes a spectrum afterwards. You see some 80-year-olds, 70-year-olds that are bedridden and are not enjoying their life very, very much for all these different complications they have going on. And then you have these 90-year-olds, like I have this one in particular, 90-year-old male, 91, goes jogging every single morning, loves his life, comes in with a smile on his face, very good shape. And I ask these people, how is it exactly, or how do you think that you ended up in the position that you're in? How do you live to 100 happily and healthily? And I've come up with, in my own opinion so far, my 5 common sense ways that most people describe doing it. And it doesn't mean that if you do these things, you're going to live to 100 pain-free and happy and healthy. But in my observations, more often than not, the happy, healthy 90-year-olds are doing these things. And the 5 things are, number 1, sleeping as well as you can through the night without going, a long time without sleeping. And I'm pretty bad with this myself. I don't have a regular sleep schedule when I'm working overnight in the Emerge, for example, but sleeping, very, very important. Next thing, not smoking cigarettes and not using a lot of alcohol. Next thing is our diet. Our diet here in North America sucks for the most part for a lot of different reasons. And I don't think that there's one in particular. You don't have to follow the carnivore diet or a vegan diet. It's just, how do I cut out the processed crap that's in a lot of our diets? And I think many people have become addicted to that over time. And it is one of those things that has such a dramatic difference on everything when you adopt a healthier diet, cut out the pop as well. Next thing is exercise. That's very, very important. I think that exercise is probably the single greatest intervention that anyone can make in their own life to live longer and healthier and pain-free. Regular exercise. And finally, the last thing is having a sense of life purpose, whether that's your family or having a job that you really enjoy or having hobbies and things that you like to do. And that's what this gentleman here is describing. And yeah, it's interesting to see from a neurosurgeon's perspective that those are the people that he sees recover and do better. So that's where I want to stop for now. It's a great video, and I encourage everyone to go and watch the entire thing because there's a lot of nuance that we can't get into, and I want him to tell his own story. But in only the time that it's taken me to film this, it's gained an additional 200,000 views and 5,000 likes. I've never seen something spread like this. But I think the message is solid, and a few different things that we could all learn from it, whether you're a medical student that wants to look ahead and see what your future could be like, or a patient that wants to see a little bit behind the scenes of what's going on and how the doctors are feeling on the other side. It is a bit of a frustrating situation, but the best that I could do is watch his story and change my practice and my habits and look out for these things in the future. He talks about burnout and depression and a few things like that as well, and try and treat people holistically. So on that note, if anyone has any questions, comments, you want to share, stories that you had, or touch on anything that I've said as well, I think it's a great video to watch. And that's my take as a brand new family medicine doctor. Thank you guys for stopping by. We'll see you all in the next one. Take care.